Really interesting news breaking this morning. A skin patch costing just 39p could help save thousands of lives by improving a patient's chances of surviving a stroke. Early testing even suggests it could halve the stroke death rate.
It's an extraordinary thing. So the idea is it works when a paramedic places the patch on the shoulder or back of a patient while on their way to hospital.
Yeah, the drug is in the patch and is then rapidly released into the bloodstream to lower blood pressure.
The blood vessels are then opened up and blood flow to the brain is improved.
We're joined now by Dr. Hilary. This sounds extraordinarily simple, Hilary, but the patch somehow can affect and halve the rate of deaths from strokes.
Yeah. One of the major problems in so many people who have strokes is that they have high blood pressure. And high blood pressure reduces the survival rate and increases the risk of disability in people who recover from a stroke. Here's the patch. It's about the size of a small badge. It's used for angina currently, and it releases gradually a medicine called glycerol trinitrate, which opens up the blood vessels, reduces blood pressure, and works apparently for people who've had a stroke either from a blood clot, which is 85% of cases, and the other 15% who've had a hemorrhage. But by reducing the blood pressure within the first few hours of somebody having a stroke and given by a paramedic in the ambulance as the patient is being taken to hospital, it appears that you can reduce the death rate. This was a small trial carried out by researchers in Nottingham and conducted by the East Midlands Ambulance Service. But what they found was the death rate went from 38% to 16%, more than halved.
Wow.
That's dramatic, isn't it?
Now they need to do a further larger trial in 850 patients across the country to see if their results are confirmed. If so, it's going to revolutionise the simple, new, inexpensive treatment for strokes.
Well, that's the genius, isn't it? Because very often these wonderful creations are then very expensive, and what we talk about, 39p or something.
Absolutely.
And I guess as well, with the message has been so strongly delivered about speed being so important for treatment for stroke. The idea that, you know, you realise someone's in trouble and you can whack a patch on to start the treatment there and then.
Very simple.
Would be brilliant, wouldn't it?
Yeah, absolutely. And, you know, we've done so much in the form of treatment for acute heart attacks that have improved survival, using clot-busting drugs, getting people into specialised units quickly and removing the problem by putting in a stent. That stroke treatment has lagged behind. This could actually speed it up and then catch up with the treatment for heart attacks. And strokes affect 100,000 people every year in the UK, causes about 40,000 deaths, one of the biggest causes of death and disability. So this is something that's really major news.
We had a tweeting from Jay Connett saying it works equally for a blood clot and for a bleed.
Yes. The way this works is it opens up blood vessels and increases the perfusion of blood to the brain, so you get less damage. Yeah, yeah, you get less damage to brain cells and better recovery. That's what we think. As I say, we need to do bigger trials to confirm that. But if it confirms the results we've already seen in 41 patients, then this simple, cheap treatment could revolutionise the way we look at strokes.